are so many numbers related to the coronavirus, and they're changing every day. It can be a challenge to understand it all. A closer look tonight with News Channel 6's Ashley Osborne.
There are thousands of COVID-19 cases reported in both Georgia and South Carolina, and the numbers keep going up, but some of those people have recovered. It's just one example of how the numbers can be confusing. So we asked Dr. Philip Kuhl to help us explain them.
The numbers can be quite confusing.
Augusta University Chief Medical Officer Dr. Philip Kuhl points out an important number to focus on.
Are we seeing an increased number in hospitalizations? And currently the answer to that question is no.
So let's start with the cumulative number of cases versus the newly reported ones. For Georgia, this graph shows the cumulative cases over time, and you can see how it keeps going up. This graph, though, shows the newly confirmed cases. The downward trend starts about April 20th. For South Carolina, in this graph, the red line represents the cumulative total. The blue bars are the new cases for each day. Next is the total number of people hospitalized versus the number of people who fight the virus from home. For Georgia, of the 25,159 confirmed cases, 1,114 were admitted to the ICU and 4,921 hospitalized. For South Carolina, 21% of COVID patients were hospitalized, 79% were not. So majority in both states recovered at home. You've also probably noticed a discrepancy between individual institutions' numbers and the state's total numbers. Dr. Kuhl explains why.
Early on, this was very manual. We literally had to have somebody sit there and enter every positive case in the system,
which caused a delay. But thankfully, he says there are more automatic systems in place now. And each state differs in how and what they record. For example, the state of South Carolina does record a recovery rate, while the state of Georgia does not. South Carolina's current recovery rate is 76%, and that changes daily. In Georgia, the Department of Public Health says one of the reasons they don't track recovery rates is because, quote, since most people have not been tested, we don't truly know how many people are infected, so we can't say with any accuracy how many have recovered. In Augusta, Ashley Osborne, WJBF News Channel 6.